Hello, everybody. This is Gary. Today is Thursday, February 16th, 2023. It's 12:49 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I'm not doing too bad. I went outside for my physical therapy exercises and my walking exercises. It's actually kind of warm here in Rochester. I believe it's above 30 degrees and there's no snow or rain, so the weather's not too bad today. I'm still having pain in my right knee from surgery last May 13th. I had torn the meniscus and I had to have surgery to remove most of it. I still haven't got any updates on my pulmonary fibrosis. I'm seeing a pulmonary specialist on March 28th. That was the earliest appointment I could get. They're going to test my lungs out, and then I'll speak to the doctor. Pulmonary fibrosis is when scar tissue forms in the air sacs of the lungs, making it more difficult for the lungs to exchange oxygen and carbon dioxide, making breathing more difficult. I haven't had a cigarette in 13 months, so I'm not sure whether or not cigarette smoking had anything to do with me developing pulmonary fibrosis. But one of the ways I knew that something was wrong is even when I go out for a normal walk, I quickly get out of breath. And it's not particularly exerting myself. I'm just walking at a normal pace outside, and I very easily get out of breath, and I have to sit down and stop and rest on a bench. So I don't know how severe or how advanced the scar tissue is. It tends to spread if the chemical that's irritating the lungs continues to be present. I'm not sure what caused my fibrosis, so I'm not sure what I'm supposed to do to stop it from getting worse. It's not cancer, and it's not emphysema. It's the development of scar tissue in the lungs that makes it more difficult to breathe. So I have a lot of anxiety about that. My anxiety levels are pretty high. I read on the internet when I first found out that I had pulmonary fibrosis that the lifespan for severe cases after diagnosis is 3 to 5 years, and I'm not even sure how severe my case is yet. So as far as my other psychiatric symptoms, my paranoia is not too bad today. My delusions are not that strong. My auditory hallucinations are bare minimum. My depression is not that severe. My anxiety levels are what you would expect under the circumstances, not extremely high. I've already did some meditation twice today. I'm making this video as part of my daily schedule. I use meditation videos from YouTube when I do meditation, or self-hypnosis as it's sometimes called. I use meditation sites like Meditation Vacation, Michael Seeley, Jason Stevenson, Tansy Forest, among others. I use a lot of different types of meditation videos. So I'm seeing my peer support specialist next week. I saw my therapist yesterday and it went well. I always feel a little bit better after talking to my therapist, regardless of what we were talking about. Psychotherapy is often just an issue of getting things off your chest more than anything else, and that's what it is pretty much for me. So I have a peer support specialist who is a counselor with a mental health diagnosis, and I have a regular psychotherapist, and of course I have a psychiatrist that does all my medications, and of course I also have a primary care provider, and I also have a couple of specialists that I see occasionally, urologists, gastroenterologists, that kind of thing. But there's not much else to report on. Everything is going pretty smoothly today. I feel pretty good. Symptoms of my schizophrenia are not that bad today. Like, comment, share, subscribe.